Director of Nursing Professional Development at San Juan Regional Medical Center. Good morning.
Good morning. Thank you so much for having me here today.
Thank you for coming in to share some information about the job that you do and, of course, the upcoming flu season in the area. And that's something that I know everyone is kind of watching and waiting for. It's now the time to think about getting flu vaccines if you are so inclined to do that. And so what are you hearing about the flu season this year? Is it going to be around normal, you think, or what are we hearing?
We think around normal. It's a little early to tell, but our goal with the vaccines every year is just to try our best based on previous years on what we think it'll entail.
Right, and that's how it's been going, and I think, a lot of the scientists and others, they kind of watch the flu season in the southern hemisphere kind of to see how it's going, and then could try to predict maybe what strains are most active, I suppose, right?
Yeah, exactly. Most active, most prevalent.
Right, and then try to get the vaccine to match that.
Match that, yes, sir.
Got it, very good. And so folks are probably hearing a lot about vaccine clinics coming up, opportunities to get flu vaccines. The hospital has set up a couple we want to let folks know about, right? So
Yes.
Those are coming up soon, I think.
Yes, sir. So we have one scheduled for October 25th.
Right.
It's a Saturday starting at 9 a.m. in the morning. We will go just until we run out of supplies for that day.
Okay.
And then we will have another clinic on Saturday, November 1st, also at 9 a.m. Keep going until we run out of supplies there as well.
Okay, and you were telling me that usually that's around noon, just kind of depends on
Yeah, it
the
can be
numbers of
around
people that
noonish.
show up.
Yeah, but the more that come, the earlier we'll finish up.
Right.
But we'll be there till we are out to serve our community.
Okay, but it all starts at 9, and these are kind of drive-through situations that
Yes,
folks can...
drive-through clinics. If you come in the corner of Maple and Schwartz, right there by the hospital, there will be flags and signs set up to guide you right through. Don't even have to get out of your car, and we'll take care of the rest.
Just roll up your sleeve, and you're all set.
Yes, sir, exactly.
That's how it works. So that's great, and that's a great reminder. And, of course, whenever we talk about shots and vaccines, I always remind folks, if you have any questions about the shot or a vaccine for you or your family, just check in with your primary care provider and ask them all the questions that you might have.
Yep, exactly. Always, if you have any questions, concerns, anything, that's your first go-to is your primary care provider.
Gotcha. Very good. And again, we have seen, though, how important vaccines can be in a large population to help kind of control some of these things. And I know some folks would say, I get this flu shot every year and then I get sick. And, why is that? Why does that happen to me? Am I catching the flu or what have you? And I know that's not the case at all, right?
Correct. You cannot get the flu from the flu shot. However, just like we were talking about a few minutes ago, the shot, the scientists do their best to predict what it will be like, but there's no 100% guarantee. However, getting the vaccine can greatly decrease your chances of getting the infection for sure.
Right. And I guess if you do end up getting the flu, it's a lesser, maybe the symptoms and the issues associated with the flu are lessened if you have the vaccine. Isn't that kind of also true?
Yes, absolutely.
Because I've heard from folks who've gotten the flu and they go, never again. I'm
Yeah.
not going to skip
It's
the
pretty
shot
rough.
ever again if I have to do that. So
Yes, it definitely helps.
it really knocks you out for a while, and so
Yes.
that's important. And I guess we see these things more during the winter months because of just our lifestyle changes. We're more inside. We're maybe more in close proximity to people, and the windows are closed and things like that. Is that kind of what causes more cases of flu and other colds and stuff in the winter?
Yep, exactly. Everybody being close together, indoor activities, and you think about the holidays, we're coming together in bigger groups, and things like that too is definitely a huge contributing factor.
Right. Other things that you can tell us about, hints to just try to keep from spreading the flu or the cold or whatever. I think we're pretty good at some of these things after the pandemic, but it always bears repeating, I think, for folks, right?
Absolutely. It never hurts to have the reminders.
Yeah.
The first thing I'll tell people is definitely wash your hands often. Try not to touch your nose and mouth if you're out and about. Keep your little hand sanitizer with you and use that as regularly as you can. Covering your coughing, your sneezes, whether that's coughing into your arm or with a tissue. If you use that, make sure obviously you're throwing it away.
Right.
And always clean your hands after that as well. Stay home if you're sick. If you're not feeling well, that protects both you and the community. It's not just about us, it's about keeping others around us safe. So make sure that you're staying home, and your body needs rest if you're sick. Even if it's not the flu, you're not sure what it is, it's a cold or anything else that is going around, you definitely need to stay home and keep yourself safe and everybody else safe.
Right.
Keeping the air fresh if you can. I know it's harder in the winter, it gets a little chilly, but if you can keep your windows open or have an air purifier, things like that can also help too, and just that fresh airflow. Getting plenty of sleep, eating nutritious meals, just taking care of yourself, keeping your immunity up, is also helpful. And then the last, I guess, biggest tip that I have is try to avoid the hospital if you are not ill, and keep our community safe that way as well, to not be around all of the other people that are in there that are ill. So if you need to go in for a visit for any reason, try not to take the whole family with you that is doing well.
Sure.
And like I said, if you're the one not feeling well, if you need to go. But if you don't need to go, then definitely stay home and don't be out and about shopping and doing all the things in the community. So.
Right. Or at least if you are, go wash your hands.
Yes, exactly.
And
Absolutely. Wash your hands, cover your cough.
All those things that you mentioned, so that's important. And I can remember a few flu seasons, I think, where the hospitals kind of put in some visitor restrictions that just, kind of limiting the amount of folks because of just how fast things were spreading, and to say, if you could certainly come and visit a patient, but maybe not bring the whole family, or maybe limit it to just, one person at a time, things like that. Now, we're not saying that's going to happen this season, but that's what the hospital tries to do to control the spread of some of these things.
Yep, exactly. Again, we're here for our community, even though I know it can be frustrating sometimes, especially if you have a loved one or somebody special that's in the hospital. But to keep yourself safe and not also become a patient yourself or somebody else that you love as well, it's the best thing to do.
Right. Very true. Very true. Well, thanks for the tips, and those are great to be able to follow. And again, it is kind of the start of flu season, so we encourage folks to consider getting a flu vaccine, and take a look around. The hospital offering a couple dates in late October and early November, or maybe your primary care physician has, I'm sure, the flu shot, or pharmacies are starting to get them and roll them out too. So tis the season, as we say. And so, but I wanted to ask you a little bit more about the work that you do at the hospital too, Blaire Chatterton, because you wear a number of, I think, different hats.
Yes.
And so let's start with your title, about talking a little bit about the Director of Nursing Professional Development. And so you are working with your other nurses there to help them learn more about the profession?
Yes, so there's a lot that nursing professional development entails. I guess the biggest chunk would be things related to nursing education. And so we have teams that support all of our different departments throughout the hospital with onboarding and orientation, any educational needs on new equipment, procedures, anything really that you can imagine that would be related to education, which is a continuous thing in healthcare in the world of nursing.
Right. So when we graduate these shiny new nurses from the nursing program here at San Juan College, they get to deal with you a little bit?
Yes,
as they show
me and
up?
my whole team of NPDs. Yes, we have an accredited nurse residency program that they joined. So my team runs that whole program for them.
Very good, very good. And so that works for the newer nurses, but also, I guess, for the veteran nurses too. There's always new stuff to learn, I suppose, in any profession, right?
Yes. The learning is never ending. So they onboard all of our experienced nurses that are just new to the facility as well.
Very good.
Yes.
Got you. And is that, how long does that take about, or is it ongoing, I guess?
Oh, the education, the onboarding, it just depends on where they're working. The education, though, is ongoing always. The needs can change, obviously, but yeah, ongoing, never ending.
Is there anything that you have seen from your job in this capacity that's kind of shifted over the years? Is it more of a focus on patient care or bedside manner or things like that, or other things that I'm not thinking about?
That's a tough question.
Is it a tough? I didn't mean to throw a tough question at you.
No.
I was just curious.
It's a good question. Probably a lot toward patient safety, and how we can do those things better, and then just a lot toward just changes in medicine of just advances in technology. And I haven't had a patient ever have this new procedure before, so what does the care look like for them? What should I expect? What signs should I look for? What complications should I look for? Things like that, because the things that we can do now is, just in the time I've been a nurse for almost 20 years now, maybe 15 years, but just from then, how much has changed is incredible.
Right.
So there's always things to learn related to that.
It sounds like it. Very true. And I think for the rest of us, for patients, I think it's always interesting, too, to be able to talk to our doctors and nurses about, if they're diagnosed with something, and maybe like, oh my gosh, my uncle so-and-so had something, and that was horrible, but now 20 years later, 10 years later, 5 years later, there's so many advances that the prognosis is probably a lot different, hopefully a lot more positive in some of these cases. And I think that's an important thing, too, that folks shouldn't think about these diseases from like 20 years ago.
Yeah, exactly.
There's a lot greater success stories, it seems to me, in a lot of cases.
Yeah, definitely.
And that's important for your nurses to know, too, I suppose.
Yes, absolutely. They are there at the bedside day in and day out providing that care.
Right.
So it's important for them to understand those things, and they do.
Very good, very good. Now, that's just one part of your job, as
Yes,
you were telling
sir.
me, because you do some other things, a lot of other things at the hospital. Talk to me a little bit about the other duties that you have.
So another team that falls into my little world is our vascular access team. We were talking about Miranda, our vascular access coordinator, was here
Just did a whole
recently.
show about that.
Yes.
That's right.
Yes, so we have a fabulous team of just 2 full-time vascular access specialists that help with all things related to that throughout the team, different types of access lines and that sort of thing. They are fabulous.
For folks who are listening, that's all like that IVs and things like that. That's what we're talking about, right? The vascular access.
Yes,
So-
I almost kind of went deeper, and then I was like, well, that's kind of my
okay.
world and language.
No, that's all right.
But all your peripheral IVs, PIC lines, mid lines, different things like ultrasound guided IVs for people that might be a difficult stick. They are specially trained to do those more difficult and challenging situations.
Right. And so the idea being that hopefully folks have a more positive experience if they have to get one of those IVs or what have you, and that the nurse or whomever is doing it is get one and done, hopefully.
Yep, exactly. And going back to the patient safety, they are very geared towards safe care, and when they do that so regularly and care for those IVs and the dressings on the lines and things, it helps keep those patients safe too.
Right. And those are so integral for care and giving nutrients and medicine or whatever it is that you need,
things,
right? And the different types of wherever they are, whether in your arm or your chest or whatever, and all those different places on the body, right?
Yes.
So
yep, exactly.
that's important. And so that's one other thing, but there's more, I think, too, right?
There's a little bit more.
Yeah.
I also, the last little bit of my little bubble is our clinical quality coordinator. So he kind of keeps up with all of our things related to stroke, chest pain, and sepsis, and different metrics that are related to those to make sure we're providing quality care. Or if there is a struggle in a certain area, he says, hey, how can we work on making this better? What do we need to do to improve the process to provide that better care for our community?
Got you. And so you work with that team as well?
Yes, it's just, he's a one-man team.
Oh, okay, so a team of one.
But yes, but we work on all of that too. I say he's a one-man team. There's a whole team that combines all of the things, but
he's leading the team.
Yes.
I got it.
Yes, exactly.
Very good. And so when you hear that, I guess, then you're able to take that information or those suggestions or things back to your team and your nurses and things like that. And I guess it might flow the other direction too. If a nurse comes up with a suggestion, you can kind of put it up through the chain of command, I guess, to say, hey, what if we did this a little differently? Would that make better outcomes for our patients?
Absolutely. And there's lots of collaboration with different physicians in the different areas and specialties, where they'll offer ideas and say, hey, can we look at this education for nursing, or vice versa. Nurses are noticing something that's happening or that is an opportunity for improvement, and they'll reach out, and I get to kind of be that channel that filters that information to others on the team.
Got it. Very good. And you've been doing all these things. Give us a little bit of an idea of your background. You grew up in Farmington.
Yes, sir.
Went away for a little while, came back.
Yes.
And here you are. And so talk to me a little bit about how long you've been doing all these different things at the hospital.
Okay. Yes, I grew up here in Farmington. Here is home. Moved away to West Texas for a while and just moved back here about a year ago.
Okay. Welcome home.
Thank you. It's wonderful to be back in this community, to be able to serve this community. It's been incredibly rewarding, and we love the outdoors, so being back for all of that is great as well. So I've been at San Juan Regional for just a tiny bit over a year and 8 days, actually.
And then they said you've been here about a year, time to go on the radio.
Right,
That's what they said.
Of course, exactly. So been doing that for about a year. I've been a nurse, like I said, for almost 15 years. I started out in the emergency room, and then have done a few little things here and there, and then have been in the world of nursing education for 6 or 7 years now. That's really my passion. It's a fine balance of loving education and still loving patient care and getting to have an impact in different areas. That's pretty cool.
Very nice. A good fit for you.
Yes,
for sure.
absolutely.
And as you came back to Farmington with your family, I mean, I think you were telling me earlier, you're kind of seeing the community with maybe new eyes, different eyes from just growing up here to now coming back and seeing it through your children and other things too about what makes the community so special.
What makes it's amazing. Growing up here, I didn't know any different. It was just kind of the norm. And now, again, like you said, seeing it through a different lens and through different eyes, seeing all the different things that we offer for the community here and just how beautiful the parks are kept. And you were talking about the event last night, the family event that is just...
Farmington Night Out,
yes,
right, with the police department.
Yes. All of those things are just incredible, and the things that we get to take our kids to do. And my daughter does theater. Both of my daughters do theater.
Wonderful.
So all of the community theater. Just there's so many things. It's just a whole different appreciation for the amazing community, and it makes it more meaningful to me to get to give back to this community when I can really appreciate all the things that it offers. It's really cool to be able to give back in a way.
Very good. Well, thank you for sharing that as well. And you may find yourself on a recruitment poster not.
All right.
Be careful, but yeah, but there you go. I know there's a lot of folks who, would like to find more locals who maybe moved away to move back
Absolutely.
and serve the community and things like that in the way that you do that. So that's wonderful. Looking ahead, is there some things that you're watching when it comes to either one of your various job responsibilities, whether it's professional development or other areas of things coming down? Do you have to stay kind of up on current trends and things in your job?
Up on all of the things,
Right.
things that are related to the specific education, things we are working toward our chest pain accreditation, and getting very close. Hopefully that'll happen before the end of this year.
Okay.
So all the things that are required for that, different metrics and standards and policies and protocols, there's just lots. It's a continuous keeping up.
I'm sure very much. You mentioned this chest pain accreditation. I know the hospital takes very seriously all of its accreditations and all of its areas and departments, and it's almost an all hands on deck type of thing because a lot of these things maybe have to flow through various departments and things like that as the folks are looking at a facility for accreditation. Is that kind of the same thing with this chest pain accreditation?
Yep.
A lot of different departments and their interactions and things?
Yes, lots of different departments, from our quality department, from, like I said, our clinical quality coordinator that helps it all, to the physicians joining, to the nurse leaders joining, to just all different hands on deck to make it happen.
Right. Very good. Well, good luck with that.
Thank you.
How far away
Thank
are you from that, do you think?
Just about pretty close. Probably, I can't remember the exact date of our visit that we have, but it's in November. So.
Oh, so yeah, it's
so
soon.
So very soon, yes.
Yeah, very
but
good.
we've been working hard to get all of the correct things in place. And again, it's about providing the best care for our patients, right? It's great to have the accreditation, but the best part is it gives you the guide on what the best standards of care are. So.
Sure. Very good. And when you talk to your nurses, the nurses that work with you and talking with them about interacting with patients, is there any advice that you have for these either brand new nurses or veteran nurses when it comes to maybe helping to calm a patient down or reassure a patient or things like that? Because it seems like they're the first string, the first people that a patient would interact with when they come to the hospital.
We spend a ton of time with these patients. Honestly, I think the biggest piece of advice that I would have is don't lose your spark. It can be hard and healthcare is challenging, but as long as you can remember your why and why you want to be there for those patients and the difference that you are making to them on some of the scariest days of their life, then you can help comfort them. You can be genuine with them, and you're a human, and it's okay to be human with them and show them your genuine care and compassion.
I like that answer. Yeah, I like that, and I think that's really important. And
Absolutely.
and that's what makes, I think, nurses such special people, because of that empathy that they show in the patient's room and with the patient and their families and things like that. So I think that's important as well. Well, we just have a couple of minutes remaining this morning, Blaire Chatterton, but I wanted to remind folks about the flu shot clinics that are coming up. San Juan Regional is offering a couple of these coming up in October and November, and so give us the details.
So October 25th, November 1st, both starting at 9 a.m. You don't even have to get out of your car. Just come drive through the corner of Maple and Schwartz. We'll get you taken care of. Just remember, it's the best way to take care of yourself and to help keep your community healthy as well.
There you go. Very good. And that will get you protected right as flu season gets underway.
Yep,
so
absolutely.
The timing couldn't be better.
Perfect. We look forward to seeing you guys.
There you go. Blaire Chatterton, thank you for coming in this morning and visiting with me about the work that you do and your colleagues at the hospital.
Absolutely. Thank you so much.
Thanks for being here. My guest this morning with me here on KSJE.